So, Dr. Carey, I am so pleased that you have accepted my invitation to be my special guest for our joint session this evening. It is so important that your voice be heard, that you be seen, because of so much of the revolutionizing work that you have done as it relates to healthcare in the African American community. Most recently, of course, you've really led the effort and secured grants from the Alameda County Department of Public Health to provide for contact tracing, the investigations, the outreach, and the health education, as well as the vaccine access issues, distribution, and you've just been on top of so much. As Again, I have to just say the first lady of a great progressive church in my district, True Vine, where your husband, Reverend Zach Carey, is doing also a phenomenal job in our community, making religion real. And so just thank you so much. You know, you're the medical director of case management for the Alameda Alliance for Health. And let me just give just a bit of personal gratitude. When I was in the California State Legislature, it was my legislation that established the Alameda Alliance for Health. And this goes back way in the day. So for historical context, I just want to say that this is one of my little projects, one of my bills that was signed into law, and you're making me so proud for doing the work that we had intended it to do way back in the day when I was in the legislature. So
that's amazing. Thank you.
So you've done remarkable work, led True Vine Ministries involvement in the COVID pandemic response. And so just tell me a little bit more about the work that you're doing so our community will understand this. And also, and I'm so glad that you were able to get the funding, because, you know, we appropriated, I think, like 90-some billion dollars. And that money was supposed to go for what you're doing. But sometimes it's hard to access because of the way federal funds are disseminated. But we sent it to the state. They were supposed to send it to the county. And then it was supposed to get to faith-based groups, nonprofit organizations, community clinics. And so I'm interested to see how this is working in my district, because we fought so hard here in Washington, D.C. And I led the effort to get this funding to be targeted to medically underserved communities. So let me know what you think's going on, and be very candid, because I want to hear what we need to do to, fix this, any of the gaps that are there.
Great. Well, first, I want to just say thank you, Congresswoman Lee, for having me today. I feel really honored to have this privilege to talk with you, because you know exactly what you're saying. What you wanted to have done was done. In Alameda County, I can say that the county did a great job of not just distributing the funds equally, but giving the funds equitably, right? So the communities that have been hardest hit are getting some funding, which we so desperately need. The coronavirus pandemic hit the African American community and the Latin community and communities of color hard because of the years previously of, medical racism, of systemic racism, of disparities in health. African Americans are the highest in, hit hardest for heart disease, cancer, cardiovascular disease, and we're pretty much at the top of almost every single health issue. And so when coronavirus hit, it just, of course, made sense that our communities would also be the hardest hit by the pandemic. And so we needed extra help because of the things that I mentioned. So thankfully, you and the federal government, you lobbied for this money. You got this money. It came to the state, and the state gave it to the counties, and the counties looked around and said, what areas in our county are hardest hit? So they looked at various, health indicators and came up with zip codes that were hardest hit by the pandemic, had high rates of coronavirus, either cases or deaths. And so those are the areas that receive funding. And our zip code in West Oakland, 94607 zip code, is one of those high index zip codes. So our church it was poised to really receive the funding because of the work we have already done in the community around social justice and violence prevention. And for the years we've been doing health fairs and block parties. So we've always been in the community. When the grants became available, we applied, and thankfully the county felt that our faith-based organization could take on the task. And so we were blessed to receive a grant to do contact tracing and contact investigation. So there are 13 African Americans from various churches actually in West Oakland. I utilized our network of churches to not just hire people from within True Vine, but also from within St. John Missionary Baptist Church and Mount Zion Missionary Baptist Church. So we call ourselves Team West Oakland because it's so many of us from West Oakland. So we have a team, we do contact investigation, contact tracing, and then we also had a grant to do outreach and health education. So I have a YouTube channel called Talking with Dr. Donna. And on that channel, I talk about coronavirus, about vaccines, about health issues. And so we've used that channel as sort of the springboard to offer more health education around coronavirus and the pandemic. We also did yard signs all around West Oakland, just with quick little messages, reminders, wash your hands, wear a mask, social distance. And we've really done surveys in the community around vaccine hesitation. Why are people getting the vaccine? Why are people not getting the vaccine? To really try to get information about what our community thinks so that we can then better provide outreach and education. And then finally, we were blessed to partner with FEMA and Cal OES and Lifelong Medical Center to offer vaccinations for about 5 weeks. And we vaccinated over 7,000 people in the West Oakland community and beyond. And I'm proud to say that the majority of those people were people of color that we vaccinated. So about 34% were in the Asian community, about 27% were in the African American community, and about 20% were in the Latin community of those we vaccinated. So I'm proud of the work that we've done.
God. Well, Dr. Donna, let me just say, listening to you really is very exciting for a couple of reasons. First of all, you are saving lives and making sure that the federal funds are being distributed the way we intended them to be distributed. And secondly, you've come up with creative ways to really conduct the public health education in terms of messaging and trusted messengers and how we can really begin to address the hesitancy. And again, a lot of people don't know, because once we write, I'm on the appropriations committee, once we write in language and the funding and the laws and like in the CARES package and in the rescue package, we do what we have to do, negotiate it, fight like you would not believe here. Yeah. That's it. We never know really how it gets to the people we intended to get. But you and Alameda County and what you have just said really kind of sets an example for how it can work to the benefit of the people. And so I just really want to thank you for staying focused, because I know it was difficult. We've talked a little bit about it. But this is exactly what we wanted to do in the American Rescue Plan and our CARES bill. So I'm really proud of everything you're doing. So let me ask you, how do you see, because I've been checking these reports out about hesitancy versus access. And I know they're both exist, but where do you think now we are in my district as it relates to, is there more hesitancy, understanding the structural racism in our healthcare system, or is it more access, or is it a little bit of both?
Yeah, I think it's a little bit of both. I think initially when the vaccines first came out, people called it hesitancy, and I never really liked that term. I don't call it hesitancy. I called it wisdom, right? In the African American community, we've known that the medical and the scientific community have not been our friends. They have done some things to us from the first moment we arrived in this country to present day that has raised suspicion and made people really leery of the medical and scientific communities. So when the vaccine came out and people were asking lots of questions, I called that wisdom. Like, that's just smart to ask questions. And to get those questions answered. I mean, we had a brand new virus that we had never seen before. We did a vaccine in record-breaking time, and we used technology that we hadn't really used before in a vaccine of this nature. So I thought it was smart. That's wise to ask questions. And so I approached our community just like that. Like, ask me every single question you have about the vaccine. I'm going to do the best of my ability to answer those questions. And then once I've answered your questions, let's see where you are. And for the majority of the people, when they ask all of the questions that they have and I provide answers, the hesitancy piece is gone. Because everybody wants to live. And we know that these vaccines are life-saving. And so people want the vaccine. They just want to be comfortable and want to know what they're putting in their bodies. They want to get their questions answered. So I think that now, though, with the pause of the Johnson & Johnson vaccine, I do feel like that's probably set us back a bit, because those people who were, had lots of questions, were still pretty skeptical about getting a vaccine. Then we have, this side effects with the Johnson & Johnson vaccine that kind of pushed people away from vaccines completely, even though Pfizer and Moderna didn't have the same effects. Just the fact that there's new vaccine and people were sort of waiting for something like this to happen, and then it happened. So I think we're going to have to do a little bit more work to get people back over that hump. But we have a vaccine clinic this weekend. We're going to be doing the Pfizer vaccines. So I'm hopeful that, I'll be out there again, talking to people, answering questions. And I'm hoping that people come and get the vaccine, those who, have not been vaccinated.
Where will this vaccine distribution occur? Can you give us the information so people who are listening will know where to access the vaccines?
Yes, so it's going to be at our church, True Vine Ministries, 896 Newton Carey Jr. Way, formerly Isabella Street in West Oakland. We will be here from 9 a.m. to 4 p.m. And we have the ability for you to walk up, but we also have the ability to schedule appointments. We found that particularly in our community that the ability to have a call-in phone number versus a website to go to, because we still have the digital divide in our community. Not every household has a smartphone or a computer or a Wi-Fi access to be able to go online to make an appointment. So we make the phone available for people to call in and make an appointment.
Good. And who's eligible at this point now in California for the vaccine?
So eligibility, because it's the Pfizer vaccine, starts at age 16. So 16 and above.
Good. Okay. And I like the way, and I'm going to talk to my colleagues about the whole issue about wisdom versus hesitancy, because, we have problems all the time with messaging. And
right.
I think what wisdom really connotes and acknowledges is that people are smart, and people, and we respect their questions and respect their reasons for asking those questions. And I think that's a really great framework, Dr. Donna, to use.
Thank
you. I'm going to talk to my colleagues about that. A lot of great ideas come from my district,
Yes.
So let me tell you what we're getting ready to do. The Black Caucus is leading an effort. I believe it starts May 1st, a GOTV effort. Okay, now, what you described has been almost like what we want to do nationwide as a campaign, because we know in many of our communities, unfortunately, access to broadband, you can't make your appointments online. We have a lot of issues around transportation. We have a lot of issues, just a lot of issues that the traditional healthcare system doesn't address. And so we're going to mount this campaign, and I hope you can be part of it, where we're going to have phone banking, mobile units all across my district. People like, what get out to vote efforts are like, right?
Yeah.
So we're doing get out the vaccine effort. And
Oh,
it's going to be a grassroots campaign. All 60 members of the Black Caucus will be conducting these GOTV efforts. And
that's
so,
great. Yeah, that's going to
so
be phenomenal.
yeah. So we want you to be really to be part of that, because it sounds like what you're doing is part of what we want to do in terms of a campaign to get people vaccinated and making sure that, again, bottom line, saving lives.
Saving lives. Yes.
So
Yes.
finally, let me ask you: do you think we will turn the corner? What do you just think overall in terms of what it's going to take to get to the finish line? I mean, we know now that, maybe a variant or two, maybe could break through the vaccine or not. Just as a physician, what are you hearing, and what are you thinking about where we are and where we need to go?
Yeah, I think the push for vaccines is still going to be our best bet, because, the virus, I tell everyone, the virus wants to be alive just like you and I. So its job is to mutate and change so that it can stay alive. But if we are vaccinated faster than the virus itself can mutate, then we can prevent it from jumping from person to person and being able to mutate. So really the effort and the push towards getting everyone vaccinated as quickly as possible is super important, because then the virus can't mutate. I know that for some of the variants that are out there, the vaccines seem to work still on those variants, which is great news, but we're really racing against the clock. So the more we can push these vaccines out into the communities, in community pods, like we've been doing with messengers that are already trusted in the community, already pillars in the community. I said, if you make the vaccine available and you make it accessible and you utilize the people who have already been in the community, it's going to make your efforts so much more successful. Like, I appreciate the large pods, but that's not going to work for communities of color. The strategy that we've been using with smaller pods, smaller, faith-based organizations, community-based organizations that are already doing work in the community, that's how we're going to get the community vaccinated. So I would say continuing to push for those vaccines. I think that the more people we have vaccinated, the better off we're going to be, and that we're going to be able to turn the corner, but not really until we get people vaccinated. In our county, the highest number of cases are in the 18 to 30-year-old demographic group. But that's not the group that we've been targeting in terms of the messaging for vaccinations. We've been targeting the elderly community because that's the community that's actually dying from the vaccine. So there's a little bit of a disconnect between who's infected and who's dying. And so for us in our health education and outreach efforts, we've been trying to focus on that 18 to 30-year-old demographic group to get them vaccinated, because they're the ones who are actually carrying the virus more than anyone else. So it's looking at the data, continuing to collect data that we can then use, relevant data, because sometimes I collect data and it's not very relevant. So that's why we actually started collecting our own data at our sites. Who was coming, what age were they, what zip codes were they coming from, so that we could then make our message targeted to what we need. So I think, efforts on the demographics that are highest, have the highest case rates, continuing these vaccination pods in the community, and just really continuing to remind people that this virus has not left. We are not done. It still continues to kill over, 1,000 people a day. That's a lot of people that are dying.
Yeah.
So,
and I remind people also to stay masked, continue physical distancing, continue with hand hygiene. Because I notice even with some of my colleagues, we forget. Sometimes they call me the COVID cop, because I'm like, no, get away. But thanks. We have to keep reminding people of that.
That's right.
So important. So, we're going to hear from the president tonight. He's going to have an exciting plan for his jobs plan, but also so much a part of this and what we put in, and I just want to mention this to you before we conclude, $7.6 billion to expand our public health workforce. And
Yeah.
so we'll have funding, Dr. Donna, and I hope that Alameda County and everyone there is prepared to hire people, to recruit, hire, and train people through nonprofits and public institutions for a lot of this healthcare work. So we put money in there to create jobs also to do this work. And so I hope that our county is going to get some of that money, as well as making sure that nonprofits and faith-based organizations continue to be a focus of us as Democrats, because I don't in Congress, at least with us, to make sure that the resources are really provided for the communities that need it the most. So we're going to keep up fighting in Washington, D.C. But we couldn't do this without you at the local level and without your tenacity, Dr. Donna, and making sure that everyone does right for our people in our community. So I just want to thank you. You can have the closing words, and then I'll see you tonight at the State of the Union.
Yes, well, I just want to say thank you, Congresswoman Lee, for fighting the good fight. You have been there fighting for us, and we so appreciate it. We are really recipients of your hard work. So I thank you for continuing to fight. And as long as you're fighting, we're going to be fighting. So thank you.
We're in this together. So thank you so much. Good seeing you. And
good seeing you too.
Pastor Zach my love and my regard.